From Vermont Public, this is The Frequency. I'm Karen Anderson, filling in for Mitch Wertlieb. It's Monday, April 7th, and here are today's headlines. A sudden reversal by President Trump's education department could leave Vermont schools holding the bag for millions of dollars in unreimbursed pandemic recovery projects. U.S. Education Secretary Linda McMahon told state leaders recently the federal government would hold back remaining COVID funds, effective immediately. That sudden announcement came just 2 days after federal education staff had assured Vermont officials on a visit to Washington, D.C. that such funds would remain available. That's according to Vermont's Deputy Education Secretary Jill Briggs-Campbell, who met with state lawmakers last week.
I would say that the landscape is dynamic and uncertain. And what we're observing is really that we're observing an administration that doesn't seem to be coordinating with itself.
Briggs-Campbell estimated school districts statewide had about $16.7 million in collective exposure. Meanwhile, recent federal funding cuts are expected to impact vaccine access for underserved communities in Vermont. Late last month, the CDC pulled back $7 million from Vermont's health department. The bulk of that money was intended to go toward vaccine outreach through organizations like the Vermont Language Justice Project. The group had planned on making multilingual educational videos about vaccines before the funding cut. Allison Seeger is the project director.
The future of how we relate with the Vermont Department of Health in producing timely information that is scientifically and factually based is really up in the air.
Last week, 23 states filed a lawsuit against the U.S. Department of Health and Human Services over the CDC funding cuts. Vermont's Climate Action Plan is due for an update in July. First released in 2020, the plan recommends ways Vermont can adapt to climate change and slash climate warming greenhouse gas emissions. This month, the Vermont Climate Council will host public hearings to collect feedback on what Vermonters want to see in the next iteration of the plan. The first meeting is April 10th in Hardwick. There will be a slate of other meetings throughout April, capped with a final virtual session on May 1st. You can also file comments by phone or online. And in other environmental news, the U.S. Environmental Protection Agency has tapped Mark Sanborn to be the next regional administrator for New England. As federal agencies see reductions in staff and budgets, EPA Administrator Lee Zeldin has indicated that could be in the EPA's future, too. In an interview, Sanborn said changes are expected at the New England agency's office, but did not go into specifics over what that would look like in programs, regulations, or staffing.
The honest answer right now is that all aspects of EPA's program and organization are being evaluated to make sure we're being as efficient as possible, to fulfill our mission, but to do it as efficiently as possible.
Sanborn is a former assistant commissioner of New Hampshire's Department of Environmental Services. In his new role, he'll be in charge of advancing the Trump administration's environmental agenda across New England states and federally recognized tribal nations. Coming up, state regulators recently approved a new adolescent psychiatric unit at a Bennington hospital, but not everyone's excited about the project. Learn why after this. State regulators last month approved a new 12-bed adolescent psychiatric unit at Southwestern Vermont Medical Center in Bennington. The vote from the Green Mountain Care Board came after the nearby Brattleboro Retreat, which operates the only other adolescent psychiatric facility in the state, strongly opposed the new project. To bring us up to speed on all of this and explain what the Bennington project means for adolescent psychiatric care across the state, Vermont Public's Howard Weiss-Tisman joined host Mitch Wertlieb.
So to start off, can you share with us a few more details about what's being planned in Bennington?
Yeah, sure. So before I do that, we'll just step back a little bit. Big hospital projects in Vermont have to get something that's known as a certificate of need. Basically, that's approval from the Green Mountain Care Board. We've been hearing a lot about the Green Mountain Care Board overseeing hospital budgets. They also approve big projects. And over the past year or so, this project has been before the board. They approved it last month. And so what Bennington wants to do is build a 12-unit inpatient psychiatric care facility for kids aged 12 to 17. So this project has received a lot of support from the Scott administration. Back in 2021, coming out of the pandemic, we were hearing a lot about how teenagers were doing. There was a desire to increase the number of beds that are available to provide psychiatric care. And so the Scott administration put out a call across the state. They put $10.5 million in the budget. And University of Vermont Medical Center originally said they were interested. They were talking about building this unit up in Burlington. But then that hospital was facing its own financial challenges. They dropped the project. The state put out another call, and Bennington stepped up and said that, they would be interested in trying to do this in Bennington. I spoke to the chief medical officer at Southwestern Vermont Medical Center. His name is Trey Dobson. He said it's a big step for the hospital. They don't provide any psychiatric inpatient care there, and this is what he told me.
Certainly, SUMC has not had an inpatient psychiatric unit, so that is a big change. And it does sound like, patients from the entire state will be coming here so they can be transported, cared for, and then returned to their communities.
Southwestern Vermont Medical Center joined the Dartmouth-Hitchcock network recently, and so Dartmouth-Hitchcock says it will provide clinicians and psychiatrists and support as the new Bennington program gets up to speed.
And there was some opposition to this project, right? What can you tell us about that?
Yeah, right. So remember, this all went through the Certificate of Need process, and the Brattleboro Retreat wanted to take part in those hearings. And during those hearings, the retreat really put forth some really strong language about this. Brattleboro is about an hour away from Bennington. The retreat, which has the only inpatient adolescent care unit right now, said, it could stand to lose about $10 million a year because of the folks who would be seeking care over in Bennington. I spoke to Brattleboro Retreat CEO Steve Cummings, and he talked about the financial impact, but he also questioned some of the data. He said that the retreat was not full all the time. They are full sometimes, but they can flex a little bit. And he questioned, investing this kind of money in a new inpatient center so close to Brattleboro. And this is what he said.
If Southwestern Vermont were to open those beds, we would see a fairly significant reduction in our adolescent census. And I think we have to work with the state and the other mental health providers to strike a balance of how much capacity can we afford to have available all the time, but not have so much that we're overspending, if you will, to have multiple beds open that never get used.
So remember, originally, University of Vermont Medical Center wanted to do this up in Burlington, and there's an argument for that. I mean, we're talking about teenagers receiving inpatient care, so this is going to be tough for families. If there's a kid in Newport or Burlington or wherever, and they have to be moved down to Bennington or Brattleboro, that's tough for the patients. It's tough for the families. So it's not really ideal to have both of these centers in the southern part of the state. I'll also say very quickly that the group Disability Rights Vermont also opposed the project. They thought that the money should be spent kind of providing services and support before the kids are in crisis. So they didn't think this was a good use of state money to build this unit that's serving 12 kids as opposed to spreading this money around and maybe supporting kids before they reach a crisis state.
Well, Howard, the overarching reality here is that Vermont's entire hospital system is really in pretty tough financial shape. This Bennington project comes after the University of Vermont Medical Center closed its inpatient psychiatry unit in Berlin, and Vermont is really struggling with how to serve youth in crisis, both in the criminal justice system and in a hospital setting. So how does the Bennington plan fit into all of that?
Yeah, so we've been hearing a lot about this, especially after the pandemic, just how kids in Vermont are doing. The Department of Health puts out an annual youth risk survey report, And, there's tons of information in there. I'm not going to go through all the data, but the most recent report, really found that many high school students are experiencing poor mental health, anxiety, sadness, and suicide. So the Department of Health says the number of teens who are waiting in emergency rooms for care is going up. And so they say these new beds are needed. I spoke with Vermont Mental Health Commissioner Emily Hawes, and, she acknowledged that it's a really tough balancing act to build a system that serves everybody. She says even if one teenager is waiting, that's too much. But she said it's really hard to balance the whole system.
Folks always want to know the question, do we have the right beds or not? Which is a valid question and also one of the most difficult ones to answer. And so I would say we want folks to have a choice. We want inpatient psychiatric care embedded with physical care and in the medical center. And we also want facilities like the retreat to thrive.
Hawes told me that the department can't control who applies for these funds, and when UVM bowed out and Bennington stepped up, the state decided to move forward, even though it means both of the state's psychiatric units for adolescents is in the southern part of the state.
So, Howard, what's next in Bennington now that the state regulators have approved the project?
Yes, so the hospital is going to have to apply for an Act 250 permit. The cost is going up. The state provided $9.5 million for construction. The cost estimate is now north of $2 million. So Southwestern Vermont Medical Center says it can cover those extra costs. And the state also gave $1 million to cover the cost of the first year of services. They really want this to be successful and get off the ground. So depending on the Act 250 process, the hospital hopes to have this new unit up in about a year and a half.
That was Vermont Public's Howard Weiss-Tisman speaking to host Mitch Ortlieb. Thanks for listening to The Frequency today. We had additional reporting from Lola Dufour, Elodie Reed, Nathaniel Wilson, and the New England News Collaborative. Our executive producer, one more time, is Kevin Trevelyan. And our music is by Blue Dot Sessions. I'm Karen Anderson. We're taking a short break with The Frequency this week, but we'll be back in your feed Wednesday. Talk to you later.
This is Tanya Mosley, co-host of Fresh Air. You'll see your favorite actors, directors, and comedians on late-night TV shows or YouTube. But what you get with Fresh Air is a deep dive. Spend some quality time with people like Billie Eilish, Questlove, Ariana Grande, Stephen Colbert, and so many more. We ask questions you won't hear asked anywhere else. Listen to the Fresh Air podcast from NPR and WHYY.